right, I think we're gonna go ahead and get started. And I will do some introductions for everyone. As you guys know, my name is Jamie Dudensing. I'm the CEO of the Texas Association of Health Plans. And, we usually do our food for thoughts during the interim when we can bring you guys lunch, but we wanted to do a very quick one today with everyone because there are two big bills up on the floor tomorrow that we thought it's very important to get you guys this information. So we're hosting this today. And we've got three experts here with us to really talk to you guys and get everyone prepared for what's hitting the floor tomorrow on insurance-like coverage on these pieces. And let's see, if you want to go to the next slide, Stacy. And I will introduce all three of them. We've got Dana Bacon, who's a regional director for governmental affairs at the Leukemia and Lymphoma Society. He has previously worked with the American Cancer Action Network and the Texas Department of Insurance. So he's a very big expert, not just on how insurance impacts stakeholders and how coverage impacts stakeholders, but he is an expert in Texas insurance law. We also have Stacy Pogue here with us, a health policy expert from Every Texan, who's a formerly CPPP. She's been there since 2008. She is one of the smartest people I've met on health insurance coverage and coverage for everyone. And she also previously worked at the Texas Department of Insurance and the Texas Medicaid Agency. And last but not least, we've got Blake, who works with AARP Texas, where they primarily focus on healthcare bills that protect consumers, like surprise medical bills and telehealth expansion. Before that, he was also at the American Cancer Society and is a very big expert on trying to help Texans have protections when it comes to health coverage in the state of Texas. And I'm going to turn it over, but real quick before I do, if anyone has a question, we've got a Q&A. You can put your questions in the chat, but it might be easier to do it in the Q&A. So click the Q&A button if you do have a question. If for some reason you want to be elevated to talk and ask the question in person, just raise your hand and let me know, and I will promote you up to the front part of this so you can ask a question to Stacy or Dana or Blake. And I'm going to let them get started.
Okay. You guys let me know if this isn't, you can't hear me or you can't see the slides, but I'm going to kick it off and say thank you to Jamie and the health plans for inviting me to be on the panel today. I'm going to let you know a little bit about the two bills we're going to focus on that'll both be on the House floor tomorrow. They both create a new type of health coverage, but patient and consumer advocates are concerned because of the unintended consequences that these bills create. So the first bill is House Bill 3924. This is by Representative Oliverson, and it'll create this new type of health coverage through the Texas Farm Bureau. And the other one is House Bill 3752 by Representative Frank, and it creates new coverage through Texas Mutual, which is an insurance company today sells workers' comp. Both of these entities sell insurance today. Farm Bureau sells home, auto, life through its affiliated insurance companies, right? It's a membership organization, but it has affiliated insurers. And Texas Mutual, as I said, sells workers' comp insurance. And in both of those cases, they comply with all of our insurance code and all the insurance laws for those products that they've brought to market. But what's unique in these bills is they're not required to follow any state laws that apply to health insurance or any federal laws that apply to health insurance for that matter. So that makes it a pretty unusual product or a pretty unusual approach. And that's a little bit of how they're the same. I want to put a pin in the Texas Mutual bill, House Bill 3752. Just look at that one just for a second because they aren't the same bill and they're a little bit different. The Farm Bureau bill, there are Farm Bureau plans in a handful of other states, and they have a track record, and you're going to hear about that. The Texas Mutual bill, I can't find any sort of similar approach in another state where a workers' comp insurer company has been singled out as starting a new non-insurance product. But I want to say that bill sets up two paths, and it leaves it up to Texas Mutual whether they follow path A, which would be selling health insurance as a health insurer would, following all the laws. In which case, if Texas Mutual chooses that path, the rest of the stuff we're going to talk about today wouldn't apply. But they have the other path carved out in the bill too, which would exempt them from all insurance laws. And that's why we're talking about them today too, because Texas Mutual could choose that path. I'm going to turn it over to Dana to talk about why patient groups are concerned.
Yeah, absolutely. Thanks for having me. I did see in the chat somebody said that they can only see a black screen. Is that something that others are experiencing or just the one person? I'm in presenter mode, so I can, okay. Well, let's go ahead and get that resolved on the side. It sounds like some folks can see the presentation. I mean, you can read the bullets. I mean, the concerns that we have about products like these is that once you start getting outside the type of coverage we've come to expect for the past 10 years with really clear sets of benefits, consumer protections, you start cutting corners. And when these corners are cut, even for the best intentioned of reasons, you're going to see problems for people who have pre-existing conditions. I was talking about it with a friend and was trying to explain what the problem is. If you get to pick who your customers are and send some people away if they're going to cost you more to cover, and those are people with pre-existing conditions, it's just like going to a football game and having one team say, we're not going to play until we get to pick 4 people on your team and send them to the sidelines. Then we'll play. And then, of course, when the team that got to pick who's out starts winning, it's not because they're great at football, it's because they wanted the rules changed to make it favorable to them. You just can't do that and not expect to see repercussions. So we're going to go into more of the technical details, but that's a lot of what we're looking at here. We don't want to see people pushed to the sidelines and have their costs go up. And we want to see everybody playing by the same rules because those rules exist to protect all of us. So looking at what the state of pre-existing conditions is like in Texas, first off, we know people want to see protections for pre-existing conditions. That is one of the most popular health policy and political statements you can make. I want to see people with pre-existing conditions get the coverage they need. Well, then you go and look and say, well, who has these pre-existing conditions? It's 28% of Texans who are of working age. It says 0 to 64, but if you look at the adult population, there are a lot of people who could potentially be excluded from coverage. That's a pretty big deal. And then again, the protections, that has nothing to do with partisanship. That is popular, whether you're to the right, to the left, in the middle. My organization and 29 others released a report in March called UnderCovered. And if you look at the bottom of the page, you can see the web address to go view this report for yourself. We looked at a host of different types of products that we would call substandard insurance or non-insurance for a variety of reasons. It can be the Farm Bureau product, it can be short-term plans, it can be healthcare sharing ministries, where for different reasons, they're not working quite like health insurance. And in every case, the problem is patients are exposed to risks, liability, higher costs. This coverage hurts not just patients, but it hurts the health insurance market as well. And we would argue that if you're going to do health insurance right, you need to be offering adequate coverage that's affordable and accessible. And when you go outside those confines, like in the case of the 2 bills Stacy described, you're going to expose people to different categories of risk. Stacy, back to you. Unmute.
Blake, do you want to do this one? Why don't I start it off and I'll hand it over to you midway. So I feel like the question in front of the House members, the legislators tomorrow, will be whether they want to vote to let certain types of health coverage discriminate against Texans with pre-existing conditions once again. And that's been illegal. You guys probably know that. Since 2014, health insurance companies have not been able to reject an applicant because of something in their medical history, or turn down somebody with pre-existing conditions. They also can't charge you more if you've got a pre-existing condition. And then the third thing I think is important, they also can't then refuse to cover your treatment. So if you have diabetes, they can't say, well, we don't cover insulin, or we don't cover your insulin. And that's true. They can't deny it or refuse to cover it just on a temporary basis called a waiting period, or permanently just exclude it altogether. The Farm Bureau plans in other states, again, they operate already in just a small number of states, but they use all three of these discriminatory tactics across the different states they operate in. And as I mentioned earlier, Texas Mutual would be allowed to choose the path of using these. And I think I'm going to hand it to Blake to tell you a little bit more about what we learned from these entities in testimony.
Sure. Yeah, so when these bills were heard in the House Insurance Committee, there was a gentleman from the Tennessee Farm Bureau. Tennessee's the state that's had the most experience doing this, and he just sort of going back to his testimony and the things that he said, he really sort of explained what we are saying is the problem with these plans. And so the gentleman said that, and I'm quoting, he said that our plans are affordable because we rate appropriately at the front end, and that rating appropriately is exactly what we mean when we say that these plans can cherry pick. So what they typically will do is when you sign up for coverage, they'll ask for a full rundown of your health. So this is how health insurance used to be back in 10 years ago. The first thing you had to do was a full workup of your health. So they'll know everything that's every pre-existing condition that you have. And then they'll say, okay, like for example, I have asthma. They'll say, okay, well, your asthma is going to make your insurance, however many more dollars a month more expensive. And so the gentleman explained that in his testimony that that's exactly what they do. So not only is the evidence in from Tennessee, but they sort of admitted to it in the testimony. Then the gentleman went on to tell a story about how they had someone that they gave coverage to that had a history of cancer. So they gave her a 6-month waiting period for her cancer. Well, unfortunately, her cancer came back a few months into her plan with the Farm Bureau, and the guy explained that for the last 2 months of her after her cancer diagnosis, she was 4 months into her coverage with them, so they wouldn't cover her chemotherapy treatments for 2 months. So she went for 2 months without chemotherapy treatments. It's sort of interesting that the guy told the story almost proudly, but I think it's really indicative of the kinds of pitfalls that this type of coverage comes with. So for 2 months, the woman had a health plan that she purchased that didn't cover her chemotherapy. That's exactly the kinds of issues that we are concerned about. And when we heard testimony on the same idea, but over at Texas Mutual, the gentleman again from Texas Mutual said that they were looking at the same kinds of things, and he said that looking at how they can avoid restrictions on health plans. He may call them restrictions, we call them basic consumer benefits. So I think the evidence is both sort of in what we've seen from these plans, but also in the testimony that came from the people that are pushing them. I'll stop there, Stacey.
All right, Dana.
Yeah, thanks. We just had a question come up in chat that's perfect for this slide, asking, does the existence of these products remove other options for other people? And I would say the problem is twofold. This one headline here, these plans drive up costs for people with pre-existing conditions. At the end of the day, insurance is about sharing risk. You calculate what everybody's risk is and you figure out how do we share it to make things work for everybody. These products want to be able to cherry pick who their customers are. So you can imagine that if there are 100 people in a community and the 10 most expensive ones are already told we can't do business with you, go to the other guy. Those people who are pushed to the side are going to be in a group that's now more expensive on average to cover. This is nothing I'm making up. I can tell you that America's health insurance plans and the National Association of Health Underwriters wrote about this stuff in their federal comments on other types of health and insurance products that are designed to exclude people with pre-existing conditions. And if you look at the last bullet, there was a report from 5 years ago analyzing marketplaces across the country, and Tennessee's marketplace has one of the highest risk scores in the country, meaning highest cost enrollees. And no small portion of the reason for that is because there was a Farm Bureau plan in place that got to pick who its customers were, and other people were sent off to the individual market. So this isn't a product that creates only winners. It definitely creates losers in the bargain as well, and we can't neglect that.
Thanks. Oh, so I'm going to quickly walk through whether the issue with these bills, if the pre-existing condition discrimination issue can be fixed, and how, of course, it's not the only concern, but it's a big one. First, again, there's three ways that insurance companies, health insurance companies, are told they can't discriminate. They can't deny coverage, they can't charge more, and they can't refuse to cover your treatment. And if you just close one of these doors, if you say they can't deny coverage, does that fix the problem? And it doesn't, because if I have a pre-existing condition and Farm Bureau or non-insurance coverage says I'd pay $2,000, but Blake's healthy and he'd pay $200, right? It's the same as denying me if my charge is $2,000 a month. Most people can't afford that, right? So it's closing one door and leaving the other two open. It doesn't fix the problem. The outcome is the same. It's the same as if I was denied. What if you can't deny or charge more? Then what? So what you're doing is refusing to cover treatment. Remember that insurance companies have a tool. They can either put you in a waiting period for maybe a short period of time, maybe it's 3 months or 6 months, or they can put you in a waiting period for a long time, like a year, 2 years, forever. There are Farm Bureau plans that exclude your treatment for your lifetime, for the lifetime of the policy. And so if I have diabetes and what I need is checkups with my doctor, lab work, insulin, and it's otherwise really well under control, I could still be paying several $100s a month in premiums, plus about $500 to $600 a month on average, then for all my diabetes treatment and medicine. And it'd work out pretty, and then taking on the risk of going bankrupt if I'm actually hospitalized or have a major complication from diabetes, right? That's not covered at all. And so again, it's almost the same as if I just got denied outright if I've told that my healthcare that I need to stay healthy or to function is denied for periods of time. And so the way to fix this, and the way that federal law fixes it for health insurance companies, is that if you want to prevent discrimination, something Texans strongly support, you have to make sure that health coverage can't do any of those three, all of those three. And Dana, back to you for affordability.
Yeah, absolutely. One of the main arguments I've seen in other states where Farm Bureau bills have been introduced is that premiums under the Affordable Care Act are high and we can compete to give a lower cost option. Now, what we're seeing with the new American Rescue Plan Act, and if you look at this graph to the right, you're going to see 6 bars, and the 5th one over is where it gets really interesting. Costs are coming down for Affordable Care Act plans in a really big way for this year and next year, to undercut even what you would see a Farm Bureau type product selling, with getting to choose who their customers are and cutting out the costly ones. That blue bar to the right, I mean, you're looking at what's called the subsidy cliff. For those of us who've been following this issue for a long time, we know that if your income goes over 400% of the poverty level, you suddenly go from getting help with your premiums to no help at all. And that is a really severe jump. I pulled some data from the Wichita Falls area to see what premiums are going to be like now that this new law is in place. And for example, a family of 4 making $120,000 a year. Last year, if they'd gone to buy let's pick a gold plan, let's be aggressive, they would have been spending almost $2,000 a month for that plan. Getting over a cold. Thanks to the American Rescue Plan Act, that premium has gone down from $19.96 a month to $651 a month. And that's with a $750 deductible individual, $2,250 deductible for a family. I mean, it's been bought down quite a bit. If you say, boy, $651 is a bit rich for my blood, what do you have that's a really low premium? You can get a $167 a month bronze plan for your family of 4 with a $6,000 deductible for the individual and you still have your generic drugs at a copay, you still have your doctor's visit at a copay. Whole point being, I can give you tons of examples. There's no longer this subsidy cliff, and the ability to compete by cherry picking who you're selling to, that's no longer an advantage compared to the price of these products, unless you're making $200,000, $300,000 a year. And then that's a pretty different life entirely.
Thank you, Dana. I am going to stop sharing because that's the end of the prepared planned remarks, and just say that I appreciate people's tuning into this today. And I think, having watched health insurance at the Capitol session in and out for several years, this is the first vote I could remember to create some sort of new coverage. Since pre-existing condition protections went into effect in 2014, this is the first vote I can think of that somehow selects people who can circumvent that protection, or selects companies or entities that can circumvent that protection. So I think it's important to understand the implications, as Dana said, the winners and losers, right, from that decision. And then I think maybe we can just see if there's questions, or if there's points anybody else wants to make that we didn't address.
I'll come back on. And just a reminder, if you have questions, you can put them in the Q&A, or if you want to ask, you can always raise your hand.
I see one to answer from the Q&A, Jamie. It's from R. Brown. The subsidy increases are for 2 years, not just one. They're the plan years 2021 and 2022. And for the question of those who make too much to receive subsidies, I mean, that gets into a little bit of a philosophical territory, and I'll tell you why. The American Rescue Plan Act was designed so that these premium subsidies would cap a family's payment for premiums at no more than 8.5% of their income, and that's for a silver benchmark plan. So I ran some quick numbers, and you would have to be making $198,000 a year in Beaumont, for example, for a family of 4 to not get help with your premiums. In Wichita Falls, the number was $306,000. The whole point being is that the high cost of a plan for that benchmark measured against your income determines at which point you'll no longer get help. So if you're that $300,000 a year income family needing help with your silver plan, then we should be talking about, yeah, what do we want our health system to accomplish? But it's a pretty high threshold before that problem starts kicking in.
And I'm just going to share my screen real quick, Dana, to show everyone this. So for, asking the question about how much coverage is in the market on this piece, I think it's really interesting to show that on average, if you even without a subsidy, the silver benchmark plan in Texas is about $430 a month and has stayed stable at that for 4 years. And if you actually look at employer coverage, you're talking about it being substantially less, employer coverage being more around $500, $600 a month. You're talking about coverage in the individual market being substantially lower and less, even when you're paying for the full cost. But most people are eligible for subsidies. And as Dana was bringing up, now as a result of the recent legislation, everyone is sort of assured that they're never paying over a certain amount of their income at this piece, at least for the next 2 years. Did we have any other questions? I think we're about to hit the 30-minute mark. We don't want to keep everyone too long, but if anyone else has a question, we'll give you a couple.
Was this useful for folks? Did this give information that was new to the discussion for you?
I'm going to assume so, because there hasn't actually been much conversation about this. I know there definitely hasn't been studied. We've got, let's see. Yes, absolutely. So we got someone. But yes, there hasn't been much conversation, and there definitely wasn't an interim charge or studies around this. So this is definitely a huge policy issue that could have dramatic unintended consequences for Texas. Oh, look, we got another question.
Not
on.
sure I understand that question.
I don't either. I mean, I will say that, you know, I'm not quite sure eliminating all regulation and consumer protections is really about giving consumer choice. I will say that for those who follow the market in Texas, we've had a large number of plans entering the market, creating huge amounts of consumer choice. At this point, I think 86% of Texans have a choice of 3 or more plans in the individual market in the counties that they live in, on this piece. But I'm not sure that creating products that can discriminate against people with pre-existing conditions is really giving people a choice of coverage.
I would point out too that kind of, if that's a niche of the market, and consumer advocates would point to problems with that there are products in the market that legislators don't have to vote to create, that exist. So short-term plans, for example, and they're not the only ones, but short-term plans, you know, don't have a lot of benefits, definitely have pre-existing condition discrimination, and are on the market now. And I think one important distinction between these bills and say short-term plans, other than legislators don't have to vote to create it, is again, that's a plan type, and lots of insurers can come in and compete in that space. It's not picking out one organization that somehow gets special treatment to circumvent the law.
I think, can I just add in? So I say to sort of say that differently. If you want a junk insurance plan, there are some out there that you could go buy today. But what's further important is that the Farm Bureau could go sell health insurance now. They just have to meet the requirements, the state's requirements, the important things that the state has thought about over the years, that the insurance committee has worked on, that we think are valuable in health plans. What they're asking is to skirt all those rules that the state has created.
Yeah, and I wouldn't want to call what they're selling junk per se, but I mean, there are consequences to deregulation. There are advantages, but there are also some pretty big consequences. And we've already talked about how creating a pathway for products like this will drive up costs for people who need access to care the most. I mean, that's a pretty big deal. We've already tried deregulation, and it's what brought so many people together to say we need to protect consumers. And we talked about that bronze plan. I mean, that bronze plan I mentioned, if you're making $120,000 a year, it's less than $170 a month. That seems like a pretty low price for health coverage.
Did you guys see there's another question, Dana and Blake?
This is how they're marketed. And I know at least in a number of the states where Farm Bureau is sold, it's sold through agents. Again, Texas Mutual is Texas Mutual, the workers' comp insurance is sold through agents. But I don't know, what the vision would be for the health coverage product. Dana, do you have more to add on Farm Bureau?
Yeah, it's typically provided as a benefit product to members of the Farm Bureau. And one of the questions that comes up in these other states, and we will have to see over time how it plays out, is, for example, I'm a lobbyist, my wife works in an elementary school. Do I join the Farm Bureau given my natural interest in farming and then sign up for this benefit? You might see people signing up just for that benefit, and it creates an additional pathway as opposed to the stated purpose of trying to meet a stated need of the agricultural community.
All right, I think that's our final question. Unless you guys want to have one more statement you want to make, I think that's it. Thank you everyone for joining us. We did record this. If you know someone that needs a copy of it or you need a link to it, I put a bunch of links into the chat for one-pagers and the studies and all the pieces that were mentioned so that you would have all that source information. And as always, you can call or email Jason or I, and of course, Stacy Pogue, Blake Hudson, or Dana, if you have any more questions before tomorrow when they're on the floor. So thank you everyone for joining us.
Thank you all.
Thanks.